Welcome back to your waiting room. It happened. You found blood in your poop and you're not sure what to do. That's understandable. What you shouldn't do is go to Google and search all of the terminal conditions that you may think you have. Hopefully this video serves as a resource and gives you more clarity for your symptoms. Watch this video instead of searching your symptoms on Google and take control of your health. You've noticed blood in your poop. First off, it happens. Let's first go over a few things that should get your immediate attention and should get you into the ER sooner rather than later. Regardless of your age, the amount of blood in your stool matters. Blood mixed in with your stool is likely coming up higher in your GI tract, and blood that spills into the toilet bowl that surrounds your poop is likely lower. Just so you know, the toilet bowl has the ability to freak you out. What I mean is one drop of blood will disperse widely in a toilet bowl, and it may seem like there is a ton of blood. Just keep this in mind. If you notice the bleeding is continuing and it is brisk, meaning fast, call 911 or go immediately to the emergency department. If the bleeding is slow, pay attention to your symptoms. Are you also lightheaded? Feel like you're going to pass out? More fatigued or tired than normal? Then it's probably better to be seen sooner rather than later. When you're young, the most common cause of non-painful blood in your poop is diverticulosis. Think of diverticulosis as small pockets in a tube, your GI tract, that form from weak spots where the inner layer bulges outward. It's not uncommon, and many people have it without even knowing. If this is what you have without any complications and with very little bleeding, what will likely reduce them from acting up is a rich fiber diet to help reduce the layers of colon from working extra hard. However, you will first need a colonoscopy to diagnose them. If it is painful, it can be an external hemorrhoid. Hemorrhoids usually are not dangerous. However, it, again, depends on how fast the blood is coming out. Is it a waterfall? Or is it an ooze? Or is it a streak on toilet paper? These are concerning findings from most dangerous to least dangerous. When you're young, other conditions exist like ulcerative colitis or Crohn's disease that may explain blood in your poop over a longer period of time. That may come or go. We'll discuss that separately in another video. If you're young and are experiencing constant diarrhea that suddenly develops into bloody diarrhea, there may be a bacterial or viral cause. Depending on where you've traveled recently or potentially any food poisoning you may have experienced, you may need antibiotics. If you're otherwise young and healthy and come to the ER with blood in your poop, you will likely get labs to make sure your body is compensating appropriately, and yes, probably a rectal exam. If there is not much blood, or any blood at all, your blood pressure and heart rate are normal, and your blood counts are normal, there's a high likelihood you will be referred to a gastroenterologist or a GI doctor for a possible scope of your rear end and your esophagus. You may get some medications to take home depending on if the bleeding is coming up higher in your GI tract or lower in your colon. If you're older, and I mean greater than age 60, there are some notable exceptions. The tests for when you are younger are the same, but your risk is higher. There are other causes than simple hemorrhoids that can be dangerous, and whether you stay in the hospital or go home depends on your blood counts and how fast the bleeding is occurring. If you're older, some important things to know are whether or not you're on blood thinners, have any family history of colon cancer, or other hereditary conditions. If you have liver failure, otherwise known as cirrhosis, you are at significant increased risk for something bad going on in your GI tract, and it is important to be seen as soon as you can in the ER. In fact, if you have cirrhosis, it's important to stop watching this video and just call 911 or go to the ER right now. If your poop is black, that can also be a sign of bleeding in your GI tract, but usually further up. Have you been having a burning sensation in your stomach after you eat? Do you drink a lot of coffee? Alcohol? Do you take ibuprofen every day? These are all risk factors for something called peptic ulcer disease, which starts as small sores in your esophagus. Think of them as small paper cuts that can bleed, and as the blood makes its way down the GI tract, it becomes black. These can be dangerous if you have significant pain in your abdomen, which may require more testing in the emergency department. However, usually it requires antacid medication to allow them to heal over several days to weeks. Hopefully this video was helpful to pull back the curtain on the ER. Please follow, like, and subscribe for more videos so you can be more informed about your health. We'll see you next time in your waiting room.